It's life-changing news for those in our province living with hepatitis C. The provincial government announced it will cover the cost of 2 drugs that cure the disease, which is the leading cause of liver failure. The news has given hope to thousands across BC.
Scanner instead.
It's called a fibroscan, and it's done to determine a patient's eligibility to have their hepatitis C medications covered by pharmacare.
That measures liver elasticity or fibrosis.
It's a small price to pay compared to the cost of treatment with Sovaldi or Harvoni. For infectious disease specialist Dr. Abu Hamour, the cost-prohibitive nature of the drugs was an ongoing source of frustration.
It was very difficult to see patients who were really in need of treatment with safer and more effective medication that had no access to those medications because of the cost.
The issues that put them at risk at first, and I think that's what...
Vanessa West at Positive Living North became a very busy person when the news of the government's decision to have pharmacare cover the costs. As a grassroots agency, Positive Living North has a firm grasp on the level of Hep C in the community.
We do have a number of our members who are people living with HIV who are also living or are co-infected with HCV. So we can just see how much of an impact this is going to have on their health.
The provincial government expects to treat about 1,500 people in the first year. Positive Living North will now begin the process of connecting Hep C patients with the information and the agencies that will best serve their needs.
Looking at our community partners such as Central Interior Native Health Society, the AIDS Prevention Program Needle Exchange, looking at our infectious disease specialist Dr. Hamour, definitely coordinating the efforts. I think that we can make a greater impact into our community.
Sovaldi and Harvoni are one-time treatments of 8 weeks to at most 24 weeks. The cost of those treatments can run into the tens of thousands of dollars, but the cost of not making the drugs available far exceeds that.
Hepatitis C is the leading cause or indication for liver transplantation in North America. And that can be quite demanding on resources.
But Dr. Hamour says the primary focus should always be on preventing Hep C rather than curing it. Cheryl Jan, CKPG News.